So if someone is actually impacted by any of these Medicare changes for 2026, the good news is you do have options. And that's important for you to know and understand what your options actually are. First and foremost, if you have an advisor, you should have already been in contact with that advisor, either them reaching out to you and scheduling or sending you a letter to schedule a review of your current plan, or either a phone call. You should reach out to them and see if you can get on their schedule to figure out what's going to be changing and how it's going to impact you. A lot of these changes can have some significant negative impacts on you. For example, if any of these plans are changing where you're discontinued coverage through your particular plan, you need to replace your current plan with a new plan. You will also get a notice of change. All of these insurance carriers are required by CMS, the Centers for Medicaid and Medicare Services. They're required to send out a notice of change. It's called the ANOC. It's the Annual Notice of Change. This will give you detailed information on your current plan coverages and a list of changes to that current plan for 2026. So you'll get either a letter from your current advisor. You'll also get a notice of change from your current carrier. Starting October 15th is the actual annual enrollment period. So we're 2 or 3 weeks away from October 15th right now, and this is when you can actually make your change to your plan. This change will take effect the 1st of January. So any change made from October 15th through December 7th will become effective January 1st. Okay, so there's 3 bullet points on how and what you need to do if these changes are impacting you. Remember, after October 1st, all of this information can be made available to you. We're not at liberty to talk about any plan changes in detail prior to October 1st. That's a different date than October 15th. October 15th is when we can actually implement the change for you. So we can talk about what's coming after October 1st. This is when all of that information is made available to the general public. And then October 15th through December 7th is when we can actually implement that change with an effective date of January 1st. If you have a plan that is being discontinued in your particular area, October 1st is when you will have the ability to find out more details about that. There again, reach out to your advisor. If you don't have an advisor, give us a call. We would be more than happy to sit down and review your current plan and to go through that with you. Then some carriers will actually do what's called a crosswalk. If there's a plan available with comparable coverages to what your current plan is, they will move you from your current plan to another plan. This is not always the case, and some companies are doing this and some companies are not. It's purely up to the company whether they want to do that. What this will entail is nothing more than getting a letter from the company. They will move you from plan A to plan B. It'll automatically start January 1st. Keep in mind, all of these changes are effective the 1st of January 2026. Now, another thing to remember, any changes that you do make during this annual enrollment period, we do get that one free do-over, so to speak. That is actually from January 1st through March 31st of next year. So if for some reason you fail to make a change, you have an Advantage plan, you want to make a change during the open enrollment period, January through March, you can do so at that time as well. That change will take effect the first day of the following month of the change. So if it's February, it'll start March 1st. So you have several options and different ways to actually make changes if you are negatively impacted by any of the changes coming for 2026. Folks, I'm telling you, there are a lot of changes, and do yourself a favor. Make sure that you reach out to someone. If you are direct from the carrier, this concerns me, and in another segment, I'm going to talk about the importance of having an advisor. But if you are direct from the carrier, if that carrier does not send a notification that their plan is being discontinued, you will not know your plan is stopping January 1st. This could leave you with significant gaps in your health care coverage moving through next year. You know, it's not necessarily their obligation, although I disagree with that. They don't have to notify you that a plan change is coming when it's being discontinued. I had clients last year. There was an entire county where one of my companies pulled out of that entire county. All of the companies fortunately reached out to the clients with a letter, and most of them will. But if you don't receive that letter for whatever reason, you owe it to yourself to reach out and find out if you're negatively impacted by this. I can help you with that. We can go through your plan, do a quick review. It doesn't cost anything for a review, and we can get that done for you. So once again, these are some of the ways that you can actually be proactive and prepare yourself for some of these changes coming for 2026. Reach out to us. Our website is americasmedicareassociates.com, and we would be happy to sit down with you and go through any of these changes that are going to impact you.